I'm very, very comfortable in that scenario, giving them testosterone, because we don't see an increase in breast density. And the other thing is, in these patients, we can certainly, if you're curious about what the testosterone is doing to an estradiol level, can't we just measure an estradiol level?
Yeah. And that's how I practice as well.
Yeah.
I know that the idea of checking labs, is somewhat controversial, which I find to be a little silly because I think that, we are data-driven people and we should have the data. But exactly, usually I'm monitoring both testosterone, which I think is pretty conventional, but also the estradiol with an ultrasensitive assay. And I have personally yet to see an elevation in estradiol. I don't know if you've seen it.
I haven't either. And so for everybody listening, for women who are on guideline appropriate testosterone therapy for low libido, yes, we get a baseline. We measure out 6 to 8 weeks
Mhm.
about, and then at 3 months, 6 months. And then if they're stable, kind of just do it every 6 months just to make sure that they're not hyperphysiologic and that they're absorbing it and it's gone up. Fine. I always, particularly my breast cancer patients,
Yeah,
right? Not necessarily in the average woman who is also on systemic estrogen, that's another conversation of whether we need to look at their estrogen levels. But
right.
in this clinical scenario, in someone who is not on systemic estrogen and people are nervous, the medical oncologist is a little nervous, oh, is this going to convert? Well, guess what? We can check it.
Yes.
So what's the big deal? So I actually say testosterone therapy